Colleagues, good morning or good afternoon, depending on where you are in the world. Welcome to the Usher COVID webinar series. My name is Linda Bald. I'm a professor of public health in the Usher Institute at the University of Edinburgh. And we're really delighted to be restarting this series with webinar 16 after a pause of a few weeks. I'm just going to run through, before I introduce our speaker, some instructions for the webinar. I know many of you joining us have been attended one of these before, but I also know there are colleagues who haven't joined us previously. So we're not able to see you as the audience, and you're not able to share your audio feed, but there is an opportunity to ask questions indeed throughout the webinar. What you will see is there are a couple of boxes at the bottom of your screen, those of you who registered on the Zoom link. And there's a Q&A panel, not the chat box, which is separate, but the Q&A panel. So if you have any questions as we go through, please do add to that panel with your question. And others, you can click on the thumbs up sign if you're interested in having that particular question answered. And then that lets me see which ones are most popular as we run through. The webinar is being recorded and it's being live streamed on YouTube, and please do forward the link after the webinar to any other colleagues who might be interested in listening in future. And at the end, after we heard from our speaker, I will let you know about the 3 other webinars we've now scheduled in the coming weeks as we restart this series. So I'm going to introduce our speaker now. Those of you who've registered will know that today we're talking about COVID-19 in India, a huge country that's faced many challenges in addressing the pandemic. We'll be talking about state and national responses, but also importantly, economic considerations and next steps. So I'm really delighted that my colleague, Dr. Rijo John, has joined us. He's a senior fellow in health economics from the Center for Public Policy Research in Kerala in India. And he's an economist and also a public health policy analyst who's consulted for a wide variety of different universities and organizations, including the WHO. He also teaches actively at the Indian Institute of Management in Kozhikode as adjunct faculty, and previous to that he was a full-time faculty of economics member at the Indian Institute of Technology in Jodhpur. He has a master's in economics and a PhD in development studies. He also holds a postdoctoral fellowship from the University of California in San Francisco, and he's held in the past full-time academic positions at a number of US universities. So if any of you have been following Rijo on social media, you know that his ability to bring together all the data on what is happening in India on COVID-19 is really very impressive. So I will hand over to him now. He'll take us through the slides. As I say, do pop your questions in the Q&A panel, and we will have 40 minutes to hear from Dr. John, and then we'll hand over to run through the questions. So Rijo, I'll hand over to you now. Thank you very much.
Thank you, Linda, for the kind introduction, and good afternoon and good morning to everybody. In India, I'm sitting here in Kerala. It's 2:30 afternoon. So I'm going to share my slides to you. All right. So I hope my slide is visible for everybody.
Yeah, perfect.
All right. Okay. So as you know, I'm going to be talking about the COVID-19 in India and how the government of India, including the different states across the country, have responded to this pandemic and where we are at the moment as far as this pandemic is concerned. And also, of course, I will be also talking about the kind of responses that the country took as the pandemic set in, and the kind of impact it had on the economy in general. Okay. All right. So the way I have structured it here. All right. So I'll be briefly talking about the demographic and health profile of the country, just to give you an idea, because you see very large number of COVID-19 cases. I mean, the kind of numbers that comes out from the country are so huge, but it has to be put in some context. And so I present you some demographic and health details for the country, and then I discuss the progression of the COVID-19 in India right from the beginning. And then I briefly discuss India's response to this pandemic. And I will then go through some details on data, which talks about the current trends of COVID-19 at the national and subnational level. And for all my data, I have all my charts today will be showing data as late as day before yesterday. That's the latest I could collect the data now. And then, of course, I will be talking a bit more detail on the kind of mortality from COVID that India has experienced recently, and also the testing strategies that the country has adopted or maybe has evolved over time, I would say. And then, of course, the last part of the discussion will focus on the impact of some of the COVID-19 responses at the national level on the economy in particular. Okay, that is how I have scheduled the talk today. Just to brief you about the demographic profile, you all know that how populous a country like India is. It has 1.3 billion people, almost 1.7 times the population of the whole of Europe, and 52% of them are males. And one of the interesting feature is the very young demographic in India. We have about 66% of the Indian population is in the age group 15 to 59, and there are only 8% of the population which are above 60 years or higher. So that's the kind of demographic breakup India has. And the crude rates, some of the crude rates, the birth rate and death rate, the crude death rate is like 6.2 deaths per every 1,000 people in a year. And 20 births per 1,000 live births. Thus per 1,000 people. So this, when you multiply with the population of the country, this translates to almost 71,000 live births and 22,000 deaths every single day. So that's a huge number we are starting with. It's good to have a perspective on these numbers before we actually look at the kind of cases and deaths coming from COVID-19 in India. All right. So moving on, to talk a bit more detail into the health profile of the country. As you know, the public expenditure on health in India is only 1.28% of the GDP as per the recent 2017-18 data. And that's a very low percentage compared to many other countries which actually devote a much larger share of their GDP on health. India has been doing a very low investment in health if you go by the GDP percentages. And of course, in India, the health is primarily a state subject. Each state is primarily in charge of managing the health in their own territories. But of course, there is a significant contribution from the central government as well. So the contribution is typically, for the latest year for which we have data, the expenditure is shared 37:63 ratio between the center and the state governments. And per capita public expenditure on health in the nominal terms have significantly increased over the last 7-8 years, and now it stands at around 1657 INR. That's a very low number, of course. What is striking about India's health expenditure by ordinary households is the high percentage of private out-of-pocket expenditure. Close to 65% of the healthcare expenditure by individuals are private out-of-pocket expenditure. So that's a huge chunk. In fact, this particular expenditure drives a lot of people into poverty every year in India. There are a lot of studies around this which talks about millions of people being pushed into poverty simply because of the high out-of-pocket healthcare expenditure that they have to incur every year for all kind of diseases. Here is a table which I collected from a recent countrywide representative survey on health expenditures in India. And this clearly shows that, less than 20% of the people have any kind of coverage on health insurance in India. And this, of course, again varies across different income groups and rural and urban India. So the bottom line here is to say that the proportion of people having any kind of health insurance coverage is pretty low in India. So that also explains a high proportion of out-of-pocket expenditures that people have to incur on a daily basis. So you can imagine, the kind of impact a widespread disease like COVID-19 could have on the finances of different households in the country. So let me now shift to my next session, that is the progression of COVID-19 in India. I just want to start with the chronology here, right from the beginning. India reported its very first case of COVID-19 from a student of Kerala who came back from Wuhan, and that was on 30th of January 2020. So that was quite late. I mean, by that date, there were so many other countries, and China was already well into the pandemic, and many other countries are also reported large number of cases by then. Significant number of cases at least by then. And by February 3rd, the state of Kerala actually declared that the COVID-19 is a state calamity, and there were only 3 cases at that time and no deaths reported. Government of India has been screening all international passengers at airports starting from March 6th. All international passengers were screened at the airport. Um, and then by March 8th, there were around 100,000 cases across across 100 countries were reported in the world. And at that time, India had only about 39 cases. By the time, there was around 100,000 cases in across the country. And it was only on 11th of March that the WHO declared COVID-19 as a pandemic. And by then, some of the individual states in India had started declaring that the pandemic, that it is indeed a pandemic. For example, Haryana, the state of Haryana declared COVID-19 a pandemic on 12th of March. And on 13th March, government of Odisha, a state government of Odisha declared COVID-19 a disaster. But unfortunately, on the same day, Ministry of Health and Family Welfare had made a statement saying COVID-19 is not a health emergency. And at that time, India had only about 91 positive cases and only 1 death reported. And we had done quite a few tests by then, and it had shown a test positivity rate of 1.4%. Okay, and by March 15th, India had a total of 100 cases, and by 17th March, our testing strategy was slightly changed. The testing primarily was limited to symptomatic airport travelers and contacts with known sources. And that was the kind of testing that used to happen till then. And by 20th of March, ICMR expands its testing guidelines to include those with symptoms but not travel history also. And then on the 22nd, there was a symbolic kind of a lockdown for 14 hours. It was called Janta Curfew, which lasted for 14 hours. And at that time, India had 403 total cases and just 1 death. And our test positivity rate was showing around 2.2% those days. And it was on 25th March, finally, India entered into a complete lockdown, a nationwide lockdown that that was supposed to have been lasting for 21 days. Of course, with this lockdown, there was an exodus of migrant workers all across the country. And I'm going to come back to this nationwide lockdown in more detail in a couple of slides ahead. This is just to show where the country stood on the day when the lockdown was declared. India just had a total of around 600 or 657 cases across the country in total, and that translated to only about 0.5 million cases. Sorry, 0.5 cases per million per population. That was the kind of scenario India was in when the country went into a complete nationwide lockdown. As you can see here, out of these 650 cases, majority of it came from Maharashtra, Kerala, and Karnataka, and a few states at the top. When you look at it from a per million population basis, it's just one state at the top, Ladakh, of course, because of its very low population, has a high 46.4 cases per million population. But for the rest of the country, in almost every other state, the case incidence was less than 5 or less than 3 per million population in most states. And in many part of the country, if you look at the northeastern sides of the country, the large number of states did not have a single case reported. So that is when the country actually went into a complete lockdown. And where did the rest of the world stand at that time? On the right hand side, you have the cases reported by countries on the March 25th, the total cases reported. Uh, so you can see that there were a large number of countries with a sizable number of COVID-19 cases by then, when India had only 650 cases on that day. On January 31st, when India had its first case, you see on the left-hand side, the yellow charts shows you how much cases other countries were reporting. So clearly you can see that as India went into the lockdown, a complete nationwide lockdown on the 25th of March, the pandemic was pretty all over. I mean, in most countries, in most of the European countries, USA, they all had very high prevalence of cases by that time. Now let me go a little more deeper into India's response, and I'm starting with this nationwide lockdown, which was sort of a massive response from the government of India. India did a staged nationwide complete lockdown from 25th March, and initially when it was done, it was intended for only 21 days, but it kept on extending, and it lasted actually for 72 days. There was 72 days of complete shutdown for the entire country. And as I already mentioned, India had about 600 total cases at a rate of 0.5 cases per million population while this lockdown was announced. And an unfortunate part of this lockdown, for my personally for me, is that the lockdown was announced at 9 p.m. On 24th March. The Prime Minister of the country comes and to the TV and says that the country is going to go into the lockdown. I'm exactly quoting the words from Prime Minister. He says, "From midnight tonight, a full ban is being imposed on people from stepping out of their homes. All the states in the country, all the union territories, each district, each municipality, each village, each locality is being put under lockdown. This lockdown will last for 21 days. And remember, this lockdown is imposed at 9 p.m. on the just 3 hours prior to when it was supposed to begin. And you can see the kind of chaos that could happen in a highly populated country like India when you don't give people sufficient time to move to their places. A lot of migrant workers having to move here and there. I mean, once you don't have jobs, you have to go back to your homes. I mean, you have to feed yourself. There's a lot of needs. I mean, so I mean, we'll go more into the details of this lockdown in the coming slides. In terms of the stringency of this lockdown, India scored a perfect 100. This is the statistics from this agency, Government Response Stringency Index. On 25th March, when India went into this lockdown, the stringency index indicated that it has one of the most strongest or most stringent lockdown anywhere in the world. And of course, soon after the lockdown was announced, on the next day, 26th March, the government of India announced a major economic stimulus plan, which consisted of 1.76 trillion Indian rupees, translates to around $22.6 billion. And this plan, of course, contained a lot of initiatives, including direct cash transfers to 200 million women and the elderly, free cooking gas cylinders to 83 million poor families, 5 kilograms of staple food grains, wheat or rice, and a kilogram of pearls free once a month for 3 months to about 800 million poor people, a plan for medical insurance cover up to 5 million Indian rupees for every frontline health workers. So there were quite a few of these items in the particular stimulus plan the government announced. But although this amount 1.76 trillion itself looked pretty high, um, the additional fiscal stimulus component of this 1.76 trillion was only about 0.8 trillion, which means the rest of the amounts were already announced in the previous budget in for the financial year 2021 budget had already announced some of these plans in the budget, and the 1.76 trillion came up including some of those measures in the budget. So the additional fiscal stimulus component amounted to only 0.8 trillion, which is approximately 0.4% of India's GDP. And then on May 17th, there was another announcement of this time a much more massive amount of 20.7 trillion, which translates to 270 billion USD, which included collateral-free loans to medium, small-scale businesses, ration cards usable anywhere, a lot of credit facilities. But again, much of this particular announcement was also in the form of credit that was announced. The actual additional fiscal stimulus component was only about 1.3 trillion, or approximately 0.7% of GDP, and the rest of it was mostly in the form of generating new credits. So it can't be really talked. This can't be thought of as a direct fiscal stimulus in some way or the other. So if you were to take these two announcements, these were the two major announcements that happened after India went into the lockdown, and if you were to add this up, it comes to a total of, say, 1.1% of India's GDP. So that is where the economic stimulus plan lies for the government. So now I will again be coming back to these stimulus plans and the impact of this lockdown in terms of how it impacted the economy and jobs, etc., towards the end of my presentation. But before going there, I would like to talk about the current trends in COVID-19, both at the national and subnational level. So here is an overall picture for you from India. As you can see here, these are not on log scale. These are real numbers. On the left-hand side, you have the total number of the cumulative number of confirmed cases, active cases, recovered cases, and deceased. They're all marked on the y-axis on the left side. And on the right-hand side, on the right y-axis, you have daily new cases, which are basically 7-day averages. So you can see here, India has crossed 2.5, as of yesterday, it was 2.7 million total confirmed cases in India so far. A large majority of them, almost 60-70%, have been recovered by now, as per government's own guidelines, policies for discharge policies. And there are about 50,000 plus deaths reported already. And the daily new cases are now averaging around 60 to 65,000 daily confirmed cases, which is one of the highest anywhere in the world at the moment. So this is where the national picture stands. This basically gives you a daily trend of cases, deaths, active cases, and the number of tests that are being done at the national level. As you can see, there is no indication of any kind of peaks at the moment. The cases are still going up every single day, almost. I mean, if you look at the 7-day, I mean, there are slight downs sometimes, but on the 7-day average numbers, if you look at the thicker lines, you will see that the daily number of cases are indeed on the increase. And so is the case with the death numbers. Obviously, our testing numbers are also catching up of late. But fortunately, the active cases have been dropping significantly, which is indeed a great thing, because as the number of cases, new positive cases increase, it's good to see that the active cases are actually dropping. That reduces the pressure on the healthcare system. Now let's look more closely into some of the states' numbers. I always insist that looking at the total national picture for India is sort of meaningless to an extent, because there's huge variation in how each states perform within India. So as you can see here, in terms of the cases, deaths, test, I've measured all these per million. Why? Because there is huge variation in the population density across the states in India. There's also huge variation in the sheer size of the population across states in India. So it's very important to look at all these numbers per million while comparing different states. So which offers a better comparison. But again, of course, you really can't compare the cities with the larger states, simply because the population density might be very different in larger cities compared to larger states, for example. So, but despite all those shortcomings, you can still see some states like Delhi, Maharashtra, which are at the top of the chart in terms of both the number of deaths and the number of cases per million. But they are not necessarily at at the top end of the chart when it comes to the test per million. In particular, Maharashtra, although they are one of the top in terms of the number of cases and deaths, they are definitely not figuring among the top in terms of the number of tests that are being done. So there are problems here, of course. And here is a picture which shows you the trend, the daily trends of cases across states which has reported at least 1,000 cases in total. So there are about 35 states now which has reported at least 1,000 total cases so far. And as you can see, some of the states seem to be peaking or have peaked already, or some have plateaued, at least for the time being. But the cases are indeed rising in many states. So as you can see, India's graph is right on top left corner. So that graph is just an average of different curves, the rest of the curves from all the other states. So that hides a lot of things there. The average picture actually really doesn't tell you anything. As the statistics differs widely across different states, and that is obvious from this particular chart. Now here, just to give you a geographical idea about where the growth is currently focused. On the left-hand side, on the orange graph map, you can see that the COVID-19 growth is now more focused on those redder shaded areas, like states like Odisha, some of the northeastern states like Sikkim, Nagaland, Mizoram, and then you have Punjab, etc. And then, of course, Kerala down there is also experiencing somewhat a kind of a surge in cases of late, and then Andaman Nicobar Islands here. So these are the states where the growth is concentrated these days. But of course, these are smaller states, so the absolute numbers from these states are pretty low compared to the kind of numbers that comes from Maharashtra or Karnataka or Andhra Pradesh these days. There's huge states and also very huge COVID positive numbers coming from these states. On the right hand side, you have the current daily test positivity rate. In fact, this is a 7-day average of test positivity rates in the past 7 days. As you can see, the test positivity rate is extremely higher in states like Maharashtra, which is actually doing much lower number of tests than what it should be doing. And then states like Andhra Pradesh, Sikkim, where very high test positivity rate. But quite a few states are having low test positivity rate here. But on the national level, the national average test positivity rate now is 7.9%. And the daily growth rate of cases is still at around 2.5%, which is one of the top among countries with at least 500,000 cases. I think if you were to look at the countries with at least 500,000 cases now, India would be right at the top in terms of the average growth of total cases that is happening on a daily basis. So that is 2.5% at the moment. And in fact, I would say this growth rate has been declining. It has been declining, but at a very low pace. That's what we've been witnessing over the last couple of months. And here is just some district data. I have only presented the trends in daily cases reported from the top 20 districts in terms of the number of total cases that they have reported. As you can see here, about 46% of the total cases reported in India and 60% of the deaths reported in India comes from these top 25 districts. Okay, so that's a sizable number. And in fact, I've been doing these kind of charts for quite some time, and I noticed, well, an interesting thing I noticed about this chart is that, uh, if when I compare the same graph for the last 1 month or so, the percentage contribution of these top 25 districts in the total case reported has been consistently declining. In other words, it is indicative of the fact that the disease is indeed spreading far and wide, because the contribution from the largest districts are coming down systematically over the time. So indicating that the disease is now spreading to more and more districts. So now I'm going to go into a more deeper discussion on mortality and testing strategies in India. I'm sure this is a more contested issue.
So that, Rijo, that's 10 minutes, just so you know.
Okay. Oh, all right. So as you can see, India reports 1.9% as the average mortality, but there is huge variation across the states. Some states have very high mortality compared to some others. What is also important is to see that there are a lot of allegations about India's mortality rate. Some people say it is highly underreported. There is some truth to it, but one has to see the kind of medical certification of deaths that is happening in India. At a country level, only 21%, the death registration is only 86% in India, which means only 86% of the deaths get registered at the national level. And only 21.1% of these are medically certified deaths. But there is huge variation across states. Some states certification is much higher compared to some other states. Okay, so but there has been a lot of media reports on how there has been undercounting of deaths across different states. There has been reconciliations of deaths which were earlier underreported, but they were later on added by some states after some investigations or some audits were taken place. So obviously there are incidents where some underreporting is happening, but so is the case in many countries. I believe there are many countries do underreporting of deaths. In fact, I happened to read a news report from BBC today morning, in which Professor Prabhat Jha was talking about the kind of underreporting that happens in many developed countries. So obviously India is also doing a lot of underreport, as if we can take these kind of reports from different states as any indication. There has been some mismatches, but as and when it was found, these numbers were corrected or reconciled. And in India also did some seroprevalence studies across different cities, and many of these surveys found a prevalence rate of 20%, 30%, 18%, 31%, etc. in different cities. And if you were to multiply these prevalences with the population in those cities, you would actually see that the inferred number of cases would be many times larger than the cases that are actually reported in those states. So clearly there is huge underreporting of cases happening, if these were of any indication. But one has to assume that because the death is very low, it's very difficult to hide the number of deaths given the kind of 24/7 media scrutiny that is happening on the kind of on this disease in India. So if we were to go by the reported deaths numbers and the kind of prevalence that is being reported from these seroprevalence studies, it is indicative of a very low infection fatality rate in the country. And I really do not know what is an explanation why the IFR is such a low number in India. There are a lot of theories around it. One possible reason I could think of as being an economist is the huge demographic dividend that India has. The only 6% of the population above 60 years or more. So that should be a major reason, one of the reasons at least, to show low IFR. And it is not just in India. In fact, if you compare the mortality rate for COVID, you can see that most of the South Asian countries, I have listed here the mortality rate not only from South Asian countries, but also from countries which reported at least a 250,000 cases. You can see that most of the South Asian countries have very low mortality rate from COVID. So India is clearly not alone in this here. So there must be something. I'm sure this must be a case for interesting study to see why the mortality rates are actually lower in India. Testing strategies by ICMR, I already indicated how the ICMR testing strategy has evolved over time. And of late, from June 14, there is an increasing reliance on rapid antigen detection test is recommended as a point of care test by ICMR. It was mostly recommended in containment zones. But ICMR, the apex medical body in India, it has also recommended that suspected individuals who test negative by this RADT test should be definitely tested sequentially by the gold standard RT-PCR test to rule out infection, whereas a positive test should be considered as true positive and does not need confirmation by RT-PCR. Yesterday, India tested around 0.9 million tests were done yesterday. About 45% of the tests that are happening in India are now these rapid antigen tests. Now, clearly, this is a change of strategy, a quantity over quality strategy, really, because the RAT tests have very low sensitivity. So the quality, of course, suffers, and there are a lot of questions around it. But obviously, this is an implicit admission of saying that we are no more in a containment strategy, but we are going more with a mitigation strategy. So probably it is not. It's more of a cost-effective strategy now to mitigate rather than trying to contain the pandemic, which is maybe not possible at this moment. And there is test centers for COVID test across the country distributed, but of course there are a lot of areas in the rural part of the country where the test centers are not easily available. So increasingly many states are reporting doing rapid antigen tests. As I mentioned, about 40 to 70% of the total tests done are rapid antigen tests by states like Delhi, Andhra Pradesh, and Karnataka. But what is unfortunate is that a lot of states which are doing these tests separately are not reporting the testing results separately. They report an aggregated testing number. Some of the states report numbers for rapid antigen test and RT-PCR test separately, but they don't report the positives coming from these tests separately. So it makes it much more difficult for researchers and public health researchers to analyze these data. So these kind of reporting problems do exist in many of these data reporting. So here is how India's test has grown. In fact, till very recently, the cases were actually growing faster than the number of tests. But only in the last few weeks, you can see that the growth rate of test has overtaken the growth rate of cases. And now you can see there has been a decline in the daily test positivity rate over the last few weeks because of this increased rapid antigen tests that has happened. And of course, there's huge variation across states in terms of the number of tests per million and the test positivity rate, as I already indicated. And also, lastly, when I talk about here, people say India has very low tests per million. But of course, when you compare a low test per million, you also try to compare the deaths per million and case per million across states. And you will see that India is right at the bottom, whether you look at the case per million or deaths per million or tests per million. But clearly, India reports 65,000 cases on average every day, close to 1,000 deaths, and 850 or 0.9 million tests every day. That's a huge number for a country like India. But when you look at it from the point of view of per million population, these numbers really are not so huge as it sounds. Now, last part of my discussion, the impact.
So we anticipated this might happen with internet issues. And we're just going to give it a couple of minutes and see if Rijo comes back on. He may join by phone. So colleagues, if you just bear with us for a minute, because I imagine we do want to hear about the impact on the economy of India and also some of the mitigation measures that are being considered. So just give it a second. And if Rijo doesn't come back, we might just switch to the manual slide sharing. So Lorna, I think what we'll do now is if you can just manually share the slides and go to the economy section, if that's all right, then when Rijo comes back on, probably on his phone, we can control the slides.
Hi.
Yep, are you back? Yeah.
Me?
Not very well.
I'm turning my video. So, yeah. So, I just turned my video off and I'm speaking through the phone. As I get the connection back on my laptop, it might be like a few minutes. I'll be back on my laptop. But if you can switch the slides for me, I would appreciate that.
Yeah, that's fine. So we're on. Lorna is slide sharing, although I can't see anything at the moment, Lorna. I think Rijo might have his. Well, just bear with you, Rijo, until you can get your back on your laptop. Take your time.
Okay, so it's almost here. Just a minute for the time. It's a time taking for all these modems to come back online. That's it.
No problem.
Just a second. I believe it's back. I'm told the other. Can you stop the sharing of the screen so that I can start sharing?
No problem. Lorna, if you can stop slide sharing, thanks very much. Great. Okay, so we're back. Thank you, colleagues, for your patience, and over to you, Rijo.
Okay, thank you. I'm sorry. Okay, all right. So let me share my screen again. Okay, where is the screen? Okay. All right, I hope you're able to see this now.
Yeah, perfect.
All right. Okay. So just to discuss about the impact of the economy due to some of the measures that the government of India has taken. India has a workforce that consists of around 471.5 million workers. And you can see the distribution of these workers. The large majority of them are either self-employed in agriculture or self-employed in non-agriculture or casual agricultural laborers. The regular employees who have regular job constitute only about 24% of the workforce. So the total wage incomes earned by all the workers in the country in a month is estimated to be at least 4.8 trillion or 2.5% of the country's annual GDP. Okay. And the CMIE, the Center for Monitoring Indian Economy, actually estimated that 122 million people, or the 26% of the workforce, lost their jobs in India in April 2020 at the time of the lockdown. That was the month where the severe lockdown was going on. And there are some other studies which suggest this figure to be up to 60 to 85%. Almost all casual workers and vast section of the self-employed in India have lost their wages. Nearly half of all regular workers, which is close to 50% in the country, do not receive any form of social security. Okay, there is this study by Thomas in 2020. He estimates that India's workers may have lost approximately INR 4 trillion, that is 2.2% of the GDP, in 2 months during the lockdown. And this study, of course, takes into account only the time period till June 1st. That was the time when the complete country had a total lockdown. But the lockdown in a slightly mild form has continued even beyond June 1st and even till today. This is just another interesting statistics. It's again another study by a well-known economist in the country. It actually looks at the arrivals in agricultural market. How the vegetables, the level of how much uh, vegetables have arrived into the agricultural market between March 15 to May 31st, when India was under lockdown in this year compared to the same period last year. As you can see on the last column, almost all these agricultural product, the arrival in the market was much lower, some of them less than 50%. So this is like the huge supply shock that has happened to the agricultural market. And of course, this is a very new thing, and a lot of studies are still in the pipeline, and we still do not know the full impact of this lockdown. There has been estimates by different international bodies like IMF, World Bank, and OECD, and ICRA. They all placed the forecast GDP growth for India, and many of these studies put a negative GDP growth in the range of 3 to 9.5% for the financial year 2021. And a very recent study which was released yesterday by the SBI, State Bank of India, they said there will be a 16.5% contraction in GDP for this particular quarter of this financial year 2021. But I want to present a more detailed study by Pranab Sen, who was one of the Planning Commission members earlier and as an economist of high esteem in the country. He estimated the impact of a lockdown on India's GDP by going through different parameters. In the interest of time, I'm not going to go into the details. But the bottom line is that there will be a net negative effect of the lockdown in India to the tune of 12.5% decline in GDP. So according to his estimates, India's GDP is going to go down by 12.5% in financial year 2021. And that is so huge actually, And not only it stops at 2021, according to his estimates as given here, the negative impact on the economy is expected to continue even into the year 2021-22, where the economy is expected to shrink by 8.8%. And it is only in 2022-23 financial year there will be a recovery according to this particular study. Okay, so that ends my presentation. I have just 2 slides here just to recap what I have said. Let me read it out for you. COVID-19 has spread far and wide in India, and the daily numbers are still rising. India's cases, deaths, and tests should all be looked at per million population due to the sheer size of its population. Success and failures of containment and or mitigation differ so widely among states and has to do with each state's health infrastructure. The mortality rate from COVID-19 vary widely across states in India. For the country as a whole, it is on the lower side, even if one allows for some underreporting of deaths. The current testing strategy seems to be an effort at mitigation in a more cost-effective manner, which is suggestive of an acknowledgement that containment is no more possible. India had one of the most comprehensive and stringent and extended lockdowns anywhere in the world. Although the countrywide lockdown ended on June 1st, it still continues in large part of the country in some form or the other. So the full economic activity has not been restored. In fact, the same stringency index that I talked about, its value currently for India is around 80%. That is close to 100, not very far from 100 anyway. And one could argue the pandemic could have been worse had such a lockdown not been there. But it could also be argued the pandemic could have been contained with the opportunity it got from the longest and stringent lockdown if it was better managed and planned. In hindsight, of course, saying these things are easier. Seeing the devastating impact of a countrywide lockdown, which happened without much preparation, one could argue a more localized strategy could have just been as effective, perhaps at a much lower cost. As I showed you, the large part of the country had almost 0 cases or no case, or very low 1 or 2 cases per million population at the time when country went into a full nationwide lockdown. But so was it really worth doing that, or was a more localized strategy more effective? Of course, it's easier to say these things in hindsight. Going by the bottom line, which is mortality, I can say one thing for sure. It is now clear that the damage to the country on account of a stringent lockdown is far more disconcerting than that from the pandemic itself. So I conclude with that, and thank you for listening. I have added all the references that I've used in the slides here if you want to check it out. So I stop with that. So open to you. for any questions.
Thank you, Rijo. That was very comprehensive, and I think we managed very well with the slight hiccup in the internet. So we've got a variety of questions. We're not going to have time for all of them, but I will just ask a few that colleagues have asked. And let me begin actually with a question on the economy. So this is from Narendra, who's posed this question. So just thinking about the recovery, which obviously many countries are focusing on now, even with the risk of future spikes, as we've seen internationally. So what are the lessons learned to help control economic damage in future months, but also in relation to other pandemics? And he suggests, for example, or he or she suggests, might a more district-wide strategy be relevant for economic recovery? Thank you.
Yeah. That's a great question, and in fact, I would completely agree with that. And personally, I'm of the view that a nationwide lockdown for a size of the country like India is certainly not effective and not called for. In fact, as I emphasized in my presentation, when the country went into a complete lockdown, there was 0 cases in many parts of the country. Many states had absolutely no cases, and there was no reason for those states to have come under a complete lockdown when there was 0 cases from those states. In fact, the state could, in fact, already many states were doing their own state-wise or more local level lockdowns before the country went into a complete lockdown. So, the central government could have given adequate directions to each state government to restrict the lockdowns only to limited hot zone areas, hotspot areas, and that would have highly limited the severe economic damage that is created as a result of this pandemic. And I completely agree with that. In future, when we face with this kind of pandemic, I think doing a complete lockdown may not be as wise, and a more local level containment strategy would be as effective or maybe more cost effective, in my opinion. Yeah.
Thank you. And a question from Professor Raj Gopal. He's asked about, and actually you already touched on this, Rijo, to some extent, the accuracy overall of COVID surveillance and also the mortality data. So if you just want to comment a little bit more on what's being discussed within the country about what the real concerns are about accuracy and how that might be improved.
Okay. Well, I last part of my presentation, I had to. I actually wished to talk a little more detail on testing and mortality, but of course I had to run through. But you're right. There is underreporting of cases, and there's nobody is denying that. There are a lot of evidence, and a lot of media personnels coming out, digging up evidence of and in fact, many state governments themselves have reconciled their numbers after being audited about the kind of reporting they did for mortality. And for instance, many states, for instance, were attributing deaths from comorbidities. They were not attributing it to COVID in the initial stages. Some states like West Bengal, almost 50% of the deaths were due to comorbidities, and they were not counting it as part of COVID deaths. But there was a reversal in such strategies, after some interventions, of course, and states like Tamil Nadu, Maharashtra, where the large number of deaths have happened, they have reconciled their deaths numbers later on, adding substantial number of deaths which were previously unreported, adding to the total tally. So see, clearly underreporting happens, but there are also reconciliations happening, at least at a later date. But you can imagine the kind of focus that the media in India has on this pandemic. This 24/7 coverage, completely focused on COVID-19. I believe it is going to be much more difficult to hide these deaths than the cases. Of course, there's large number of asymptomatic cases. They may not be reported, of course, but deaths, I believe the level of underreporting for deaths might be much lower than the cases, for sure. And one has to, of course, understand the fact that it is not just in India. In fact, many other Southeast Asian countries have a relatively lower mortality. I don't know. There are theories by epidemiologists. Some of them say that it could be because of pre-existing immunity that some of these populations might be having. I don't know. I'm an economist. I cannot comment on those things. But one clear advantage for me, I can see for India and other South Asian countries in general, is that all these countries have a relatively younger population, and that could be the reason why you see a relatively lower mortality rate in these countries. But that said, I agree there might be underreporting. Definitely there is underreporting, and many countries do, and India might have a much higher rate of underreporting than many other countries. I'm not denying that. But still, even if one were to account, I mean, even if, let's say, if I were to double the number of cases that is reported in India, I mean, let's say, let me double the number of deaths and say 50% of the deaths are underreported. But still, I would say the mortality rate in India is lower than many other countries out there.
Yeah, and that does seem to be, as you say, that useful chart you had with the other countries with younger populations from South Asia, but also other parts of the world. That definitely seems to be a pattern. So Subhash Kali has asked a question, which actually I myself wanted to ask. It's about the serology work that's being done. So the serological surveys, they vary across states. But one of them had a positivity rate of 51%. So when we look at the data from European countries, for example, you're seeing these surveys coming out with 5, 10, 12%, 13% in London, I think it was.
Yeah.
So, is there any, are we debating that herd immunity is happening in India, or does that just seem like maybe some of these results are not that reliable?
Well, these sero surveys that I reported in my slide today, there was only one study from Pune which showed this 51.5% prevalence. That particular sero survey was actually conducted in only high incidence areas in the city. So it was not a representative sample of the total city. So you can't really project that number to the city population. So the survey report clearly says that they surveyed the samples only from high incidence areas within the city. So probably that's not the right number to be talking about. But other surveys, in the table, for example, from Delhi, which showed this prevalence of 23%, which had a large and representative sample across the city. And that is a more reliable number to talk about. Of course, but still, I would also say, despite all this, most of the sero survey, we have had only 5 or 6 sero surveys in India. I mean, that was all concentrated in big cities so far. And you must remember that these cities are also highly densely populated, and the prevalence numbers that are coming from these surveys are far more than the kind of sero survey prevalence that you see from other parts of the world, where most of the sero surveys report 15% or less prevalence. But in Indian studies, you see many of them reporting 20% or 25, sometimes even 30% prevalence, which is somewhat high. And again, there are theories floating around. People say that this could be, dengue antibodies cross-reacting with the test. I don't know. I mean, again, as I say, I'm an economist. I really can't comment on this, but there are such theories going on. So is it really the COVID positives that are being identified in these surveys? What is the actual sensitivity of these kind of survey procedures that are used in the testing that they're using? I don't know. I mean, I really can't comment. But of course, does it really mean that we're at a herd immunity? I don't know. I mean, what is herd immunity? Is it 30% or 50%? What is that? I mean, do we know that? But clearly, there's only one study, as I said, is 51% showing, but that again is only in a very small containment area, so it can't be extrapolated to the rest of the city. But large part of the country, I'm sure, is still way far from any kind of herd immunity that you can think of, I believe.
Yes, particularly outside of the urban centres, as you say. I think we only have time for one more question. We can send on the other questions that colleagues have posted. But Roger Jeffrey has asked, is there any possibility at all that India's public health system, which we know varies across the country, and some very strong infrastructure and then weaker infrastructure, would the public health system be able to benefit from the publicity of some of the weaknesses that COVID has highlighted?
Well, if only the state takes true lessons from this, it can clearly benefit the public health system. How, for example, how some of the states have been able to keep the mortality much lower compared to some other states. Clearly I'm from Kerala, a state which does relatively far better in terms of all kind of health indicators in the country. And that state has very low mortality, like 3.3% is the mortality figure in Kerala compared to, say, Maharashtra or Gujarat, which has 3.5% of mortality. So and even Tamil Nadu, the adjacent state to Kerala, which again is known to have a very robust healthcare system, has a relatively low mortality from COVID compared to other states. So that is the bottom line. States which are having better healthcare infrastructure are being able to manage the pandemic much better than other states, and that is very evident when you analyze the state level data in India. And I'm sure if this were any indication, going forward, it should be an incentive for the other states to build up their own health infrastructure to deal with these kind of pandemics in future.
I think that's a very good place to end. And of course, as you know, Rijo, even within the UK, we have a debate about which parts of our country are dealing with the pandemic more effectively than others. So I just wanted to thank you very warmly for that really excellent and comprehensive presentation, and also to have the economic aspects highlighted, which we haven't had in our previous webinars. So sincere thanks again. If colleagues who posed questions and have not had them answered would like them answered, please do email the Usher Comms team and we will forward those questions to Rijo. So Rijo, thank you very much again. I'm going to just explain about the next webinars now and then I'll close. Thank you. So Lorna, if we could, or Laura, have the screen, thank you. So we've organized 3 more webinars, and as I always say, colleagues, if you have requests for future ones, please do email them to Usher Comms. So the next webinar, which was in response to a request, is looking at the important work that's been done by Public Health England, very timely, but also by Public Health Scotland and academic colleagues. So looking at the impact of COVID-19 on ethnic minority communities in England and in Scotland, and crucially recovery strategies. So you'll know PHE's report had 2 parts. We'll have 2 different speakers focusing on each element of that. That's on the 26th of August. Please do join us. We're running them every couple of weeks now as we move forward. The next one, again, I think we'll have huge interest here. The really tricky situation in Australia now. So we've got 2 excellent speakers, one from New South Wales and one right in the middle of it, working jointly with the university and the Department of Health in the state of Victoria. So that's the 11th of September. And then on the 24th of September, we're joined by our colleagues from here in Scotland who will be focusing on physical activity in prevention and recovery from COVID-19, building on the previous NCD-related webinars we've had on tobacco and on overweight and obesity. So please do join us for that. And I'm actively considering other countries, other topics. So as I say, please get in touch if you have ideas. So we'll close it there. And just to pass on sincere thanks again to Rijo, John, but also to the Usher Comms team and to our director, Aziz Sheikh, who helped set up this webinar series. So I hope to see many of you on